Assalamualaikum and good morning. Today our group 3 of Principle of Psychology will present about mental disorder, which is ADHD. Okay, today's presentation we're going to discuss about the definition and type of ADHD, which is attention deficit or hyperactivity disorder, cause and symptom of ADHD, treatment and the aspect of drug and psychology of ADHD for ADHD, and the last one is case study. So for the definition of ADHD, ADHD is a type of neurodevelopmental disorder. It affects the developmental neurosystem develop for a person and most commonly occur in childhood and will last until adulthood. The children have ADHD may have trouble in paying attention, controlling impulsive behavior, and can be overactive. And based on National 2016 Parent Survey in US stated that 6 over 10 parents have their child facing ADHD. And the statistic also in US stated that 8.1% of the population have ADHD from their childhood until their adult. Okay, so we will discuss about the type of ADHD. The first one is predominantly inattentive. The person often have trouble staying focused on tasks at work, home or play. They frequently does not pay close attention to details or make careless mistake at work or while doing another work. The second type of ADHD is predominantly hyperactive impulsive, which is contrast to the first type of ADHD. It is characterized by the symptom of impulsivity and hyperactivity. The patient will develop sign of attention, but it is not as marked as the other symptoms. And they also often squirm, fidget, or feel restless. The last one is combined type of ADHD. It is a combination between the first and second type of ADHD, and it is common type faced by the person or child. And they will display both inattentive and hyperactive symptoms. Next, we will discuss about the cause of ADHD.
So next is the causes that lead to ADHD. Firstly is genetics. ADHD tends to run in families, and in most cases it shows that the genes inherited from parents are a significant factor in developing the condition. Secondly is brain function and structure, which is abnormality in brain structure. In simple terms, that the frontal lobe is the part of the brain that helps to do work and complete tasks. Research has found that this part of the brain is smaller in people with ADHD. However, in some cases, this is a method of delayed development, and the frontal lobe in people with ADHD goes to a normal size later. Thirdly is group at risk, which are baby born premature, person with epilepsy, baby having brain damage. Fourthly is exposure to environmental risks such as lead. Exposure to high levels of lead may cause anemia, weaknesses, kidney and brain damage. Lead can cross the placental barrier, which means pregnant women who are exposed to lead also expose their unborn child. Lead can damage a developing baby's nervous system. Lastly is maternal habits during pregnancy, which are poor nutrition, smoking, which has tobacco that can cause developmental delays problem, and also alcohol use.
Okay, for the signs and symptoms of ADHD, there are three types, which is for inattentive ADHD, the person will experience such as missed details and are distracted easily. They will get bored quickly. They will have trouble focusing on a single task, have difficulty organizing thoughts and learning new information, move slowly and appear as if they are daydreaming, and lastly, they have trouble following directions. Next, for hyperactive impulsive ADHD, the signs and symptoms they may experience is squirm, fidget, or felt restless. They will touch and play with objects even when it is appropriate to the task at hand. They will have difficulty sitting still. They will have trouble engaging in quiet activities. They will talk constantly, blurt out answers and inappropriate comments, constantly on the go, and lastly, they are very impatient. And lastly, for the combined type ADHD, as we know, ADHD tends to show up as predominantly inattentive and predominantly hyperactive impulsive. But when someone has six or more symptoms of each type, they will have a combined type of ADHD.
Next, the course of treatments for ADHD are divided into two types, which include medications or drugs and also psychological treatments. I'll be covering the medication or drugs treatments. Under the scope of medications, there are two types of FDA-approved drugs, which are stimulants and also non-stimulants. FDA-approved drugs, which are means that data on the drug's effects have been reviewed and the drug is determined to provide benefits that outweigh its own and potential risks for intended population. In this case, it is for children or adults who suffer from ADHD. The two types of medication, which are stimulants and non-stimulants. Stimulants have three different group, which is Ritalin group. The drugs is methylphenidate. Adderall group mixed amphetamine salt. This dexedrine group, dextroamphetamine. For the non-stimulant, three types of drugs uh, are Stareta. The drugs is atomaxetine, Intunif, guanfacine, Capvey, which is clonidine. Okay, for the alternative, there are some case study showed that caffeine and herbs also may help in treating ADHD. Okay, for the stimulants, amphetamine and methylphenidate, it is a fast-acting drugs which take about 30 to 60 minutes to give effects towards the patient. It also produces calming effect on hyperactive children with ADHD. It increased brain levels of dopamine, which is a neurotransmitter associated with motivation, attention, and also movements. Secondly is non-stimulants. The drugs are atomoxetine, guanfacine, and also clonidine. It may take several days in comparison to stimulants. The non-stimulants drugs will be given to patients who are unable to tolerate or benefit from stimulants. The possibility to be given non-stimulants is about 20 to 30%, as stimulants have 70 to 80% of successfulness. Basically, it helps to increase the quantity of norepinephrine, which an essential brain neurotransmitter. It helps boost a person's attention span and also reduce impulsive and hyperactive behavior. So basically, the other alternative of stimulants, um, caffeine, which can boost concentration for people with ADHD. Since it's a stimulant drug, it mimics some of the effects of stronger stimulants, which is amphetamine. Herbs like ginkgo, ginseng, and also passion flower may also help give calmness to hyperactivity of patient with ADHD. So basically, when we talk about medication and also drug, there must be side effects of the medication. For the common side effects, can be seen is decreased appetite and weight loss, trouble sleep, stomach ache, and also headache. These common side effects may appear due to first phase of consuming medication, about 1 to 2 weeks of consuming the medication. Secondly is the occasional side effects, which is less likely to occur. The patient might feel spassiness or too serious, rebound irritability, tics, hallucinations, fast heartbeat, high blood pressure, and also decrease in growth. These side effects may appear, but less likely compared to common. So last one is unclear. Risk of heart problems. Studies now indicate no increased risk unless the child had a heart problem prior to the medication. In this case, the child might have heart problem in the first place that will increase the risk when he or she consume the medication. Thank you.
Alright, thank you, Fatin Najwa. So I will explain about psychological treatment. First is behavioral psychotherapy. Okay, this involves both children and adults. So for children, we can teach them on how to time management, and organizational skills. So this involve both parents and children. This involve both parents and teachers, as it may be helpful for them. So for adults, we can decrease distraction and improve organizational skills. So second is cognitive behavioral therapy. This is a type of talk therapy. It involvement of thoughts, feelings, and behaviors, and it teach people with ADHD on how to replace negative thoughts with more realistic and positive one. Okay, for example, is I am stupid and I cannot learn. So we replace it with I am good at a lot of things. So third is social skills group. It is run by a professional to help people with ADHD to learn and practice important skills for interacting with others. So people with ADHD will learn on how to greet others, start a conversation and respond to others. So this will be may helpful to for their social skills. So I will pass this presentation to Adriana Camila.
Okay, last but not least is our ADHD case study. So our ADHD case study focus on Jeremy. Jeremy is a 55-year-old Latin American boy in Arizona with a mohawk style of hair. So Jeremy is the youngest child in the family, yet when he first came to the doctor, the other siblings were afraid of him. He beat, hit and kicked his 12-year-old brother and 17-year-old sister. When his mom attempted to discipline him, Jeremy screamed and threatened his mother. Despite his threats, he did not actually mean that he wanted to die. He just used the expression to manipulate his mother. Mom was concerned because he constantly bit his nails to the point of leaving marks on the tips of his fingers, and he picked his nose all the time. He wet the bed 4 nights a week. Jeremy's behavior problem bleeding into the classroom and causing trouble at school. He had difficulty learning, getting frustrated easily, trouble focusing, and would lose his concentration after a few minutes and would throw a tantrum at school. He couldn't follow instructions and would get distracted easily. Mom reported that it was difficult to get him to sit still in his seat because he would fidget, squirm, and was very impatient. Jeremy's symptoms also showed that he craving for eggs and would eat them 1 to 2 times a day. He also craving for ice cold popsicles. He would chew the icy popsicles. At night it was very difficult for him to get to sleep because he would wide awake and wanted to play until at least 1 in the morning. When he finally fell asleep, he would kick off his covers and tear off all his clothes because he would get hot. He was also afraid of the dark. He had a fear that there were ghosts under his bed. From a diagnostic perspective, it appeared to that Jeremy most likely to suffer from ADHD, predominantly hyperactive impulsive type. These are the kids that worry will develop conduct disorders and involved in drug-related or other criminal activity in their teenage years if they don't get help. Jeremy started with a single dose of homeopathic medorrhinum 200C because the most characteristic symptoms in the case were biting the nails, chewing on ice, fear of the dark and ghosts, and desire to stay up late at night to play. On February 17, 2010, he returned for his follow-up on medorrhinum 200C single dose. He was no longer as aggressive and was not hitting his siblings as much as before. The restlessness and impatience was improved, and he was no longer threatening his mom when he got in trouble, and he would respond by apologizing rather than threatening his mom. His mom also reported that overall Jeremy was much more calmer, and it appeared that he reacted positively to medorrhinum 200C, and it was time for another dose. So on March 13 March 2010, he came for the potency eventually went up to medorrhinum 1M when he was no longer improving for the 200C. He was much calmer, and many of his symptoms continued to be improved, including being less aggressive and much more lovable than before. So, um, even though his behavior was much more manageable, yet he still had moments of being really stubborn. And I think that's all for our case study. And there are several references that we referred for our ADHD topic.
Okay, that's all from our group. Thank you.